it seems things won't turn out perfectly when you want them to. And there is one thing you can do.
Now, you talk about in the book also Biotouch. You did research in Biotouch. What was your discovery on that?
I was working in Tucson, Arizona as the associate medical director at a clinic called St. Elizabeth of Hungary. This clinic had been in operation for over 100 years. Wow. And it was started by some nuns in southern Arizona. And we had mainly volunteer staff. We had dental care and medical care, as well as some other modalities available. And at that time, pain was the fifth vital sign. And doctors were always advised to inquire about how patients were managing pain. And so I would see patients with osteoarthritis and degenerative disc disease and connective tissue disease like rheumatoid arthritis or sarcoid or fibromyalgia. And I would ask, do you need any pain medication today? And they would say, no, I just see Sister Mary and get Biotouch. And I was a little puzzled by this. And I heard this answer enough times that I became really curious. And so I went to the medical director and I said, tell me more about Sister Mary and Biotouch. And he said, oh yeah, Sister Mary comes twice a week and she does Biotouch for our patients that have pain or stress. And I don't know much about it, but you can find out more from her. Well, the practice was very busy, and I certainly hadn't heard anything about touch therapies in my medical education.
No.
And so I was, of course, distracted by a heavy patient load. But one morning, I got to work and I had a severe migraine headache. I had already taken over-the-counter medicines and they didn't touch it. And I wondered how I was going to get through my day. Like many good physicians, I went into the sample closet to see if there were any sample drugs that I could take for my headache, and nothing there. And so I went and sat down at my desk and heard a knock on the door. Hi, it's Sister Mary. I see that your first patient canceled. Do you want to try Biotouch? And I couldn't say no.
Talk about synchronicity.
Yeah. And like any good investigator, I did not tell her that I had a severe headache. She said, is anything bothering you? And I said, no. And she said, well, I'll just do the headset because that's the one that we do to introduce patients to the technique. And so she just very lightly touched my head in certain points that are designated by the Biotouch technique. And within seconds, my headache dissipated. It was completely gone. And I thought, I want to learn more about this. And so I think that it was about 3 years later when my career path had taken me back to Texas, to the University of Texas Health Science Center in Tyler, that I had the opportunity with some seed money to investigate Biotouch. Sister Mary came along with some other members of the foundation that's based in Tucson and taught over 24 nurses, doctors, physical therapists, volunteers how to do the Biotouch technique. And from that point, I was able to do very specific investigations of Biotouch. And this included measuring immune signaling factors. It included even skin biopsies before and after Biotouch, looking at gene expression. And our findings were amazing as it relates to the power of touch to improve health.
That's fascinating. Ooh, this book is a book that every woman, well, actually the men need to pick it up too, because I think there's a lot that can apply even to the gentleman that would pick up a book like this.